Hi, my name is Katie Deming. I am a radiation oncologist specializing in breast cancer and founder of MakeMaryBody.com. Today we're going to talk about what to expect during radiation for breast cancer. And most women expect that the side effects are going to be really terrible and it's going to be a really hard experience for them. But for the most part, actually, radiation for breast cancer is really well tolerated, and most women do quite well and work full time and kind of carry on all their normal activities while they're having treatment. So let's just dive in and talk about some of the side effects that you can expect. And we'll also talk about some of the things that you can do to make those side effects a little bit easier. The first side effect that is most common for women who have radiation for breast cancer is a skin reaction. And that is really like a sunburn, although it's different than a sunburn. So it is skin redness that usually starts in your third week of treatment. Now, courses of radiation can range from anywhere to 3.5 weeks to 6.5 weeks of treatment, or even 7. And so the skin reaction doesn't start until the third week in any of those courses. But kind of the timetable for it to peak depends on the length of your course. So if you have a 3 or 4 week course of radiation, you're going to notice that skin reaction starting at the end of the third week, kind of right when you're getting ready to finish. The skin reaction is going to peak at 5 days after the radiation, and then it's going to start to get better at 7 days after the treatment is finished. With the longer course of radiation, it's again going to start at the third week, but it's going to be very gradual, and it's just going to gradually get more and more red, like a sunburn. It's going to peak right when you finish the treatment, and then it's going to start to get better. So the timetable can be different for different courses of radiation, but in general, the skin is a kind of light pink at the end of the third week. And then by the end of treatment, or in the shorter course of radiation about 5 days after, it can be quite red, like a moderate sunburn. I would say most of the time it's like a mild to moderate sunburn, and then we'll get basically darker, like a tan. It'll fade to a tan, and then that tan will fade over the next couple months. The one thing to note is that skin reaction will be like a box over your breast on the side that's being treated. And if the lymph nodes are being treated, you might also have redness up under the arm and over your clavicle right here. Skin creams are really important for preventing this skin reaction, and your doctor will talk to you about what skin creams they prefer. Personally, I use Mioderm on all of my patients because it has calendula is the one ingredient where there is data to support it decreasing the risk of burning and peeling. And then that product also has aloe vera, which is soothing for the skin, vitamin E, which is moisturizing, and hyaluronic acid, which helps the moisturizer penetrate into the skin and helps kind of absorb all of those good nutrients that are going to help your skin during the radiation. But it's really important that you talk to your doctor and find out what they recommend, because every doctor has kind of specific preferences about what they want you to use during treatment. But that's what to expect in terms of the skin redness. Now, the other side effect that people can notice is fatigue. Fatigue is usually mild. I would say it's unusual for women to have significant fatigue during radiation to the point where they can't work or do other normal activities. But the fatigue can be real, and it can start as early as the first week of treatment. I would say in general, it usually is gradual and starts in about the third week. It's usually mild. Most women find that as long as they kind of organize their days so that after dinner they don't have a lot of other things to do, that they can kind of make it through their normal work day and do all their normal activities. But I would say you do yourself a favor by making sure you have help in the evening. So once dinner's on the table, most women are kind of, checked out and done for the day. And so making sure that your partner or family members can kind of help out with those evening activities and not overscheduling yourself during the evening while you're having radiation. One other thing that is really important with reducing fatigue during radiation is exercise. There are studies that show women who exercise during radiation have less fatigue and it makes the radiation work better, meaning they have lower risk of the cancer coming back. So that's a good reason for you to make exercise part of your regular routine starting during radiation. The exercise does not have to be vigorous, so it can be as simple as walking, but it should be 150 minutes a week, which basically would break down to maybe 30 minutes 5 days a week. Does not have to be consecutive. You can do 20 minutes in the morning, 10 minutes in the evening, or however you break it up is fine. It's just getting that physical activity, getting the oxygen to your cells is really going to help you during this treatment. And I think it's a good reason to kind of make that change in your lifestyle to incorporate exercise. The last thing that people notice is tenderness, or swelling or irritation of the breast during radiation. And this is due to the skin reaction, which we talked about, but it's also due to blood flow. So your body's response to the treatment each day is to flood the area with blood to try and stimulate DNA repair and healing. And that's actually a good thing. So you want that. You might notice that your breast feels warm after treatments. You might notice that it feels swollen. And all of that is really just your body doing what it's supposed to do to repair the damage that's occurring. So some of the things that people notice from that, though, is it feels almost like you have a period and that your breast is swollen. Wearing a bra is actually really important to help with that tenderness and swelling in the breast because it gives you that level of support that decreases the tenderness. Many doctors, I was trained this way myself. I had doctors who said, just tell women to go braless during radiation. And actually it's quite painful. It's not comfortable to go braless most of the time anyway, but then when your breast is swollen, it's certainly not comfortable for women. So wearing a bra that has light support is really important to help give you that light comfort that decreases kind of tenderness and soreness while you're walking around and doing all your normal activities. Some women actually find that they feel better to sleep in a bra as well. So having a light support bra to sleep in makes you feel better. Not all women need that, but that's certainly something that a lot of women do during radiation. The other thing is that because the skin is so irritated, you're going to find that things that you didn't notice about your bras before are irritating. So seams under the arms, elastics against the skin, fabrics that have kind of polyester or other synthetic fabrics can be really irritating. Actually, sometimes cotton can be irritating because of the way that it's processed. So wearing a light support modal bra like ours on Make Merry really is designed specifically for women undergoing radiation therapy. And really the reason why I developed these products was because there was nothing on the market for my patients, and it was really frustrating to know they were going to develop this skin redness and soreness and irritation, and there was nothing available for them to wear. And then the things that were available for after surgery were really medical and not very much what you would want to wear kind of going about your normal activities and working and what. So check out the Make Merry bras because I think that it is something that makes women feel comfortable and kind of get through the treatment, and hopefully you'll love it and wear it after that because it really is designed to be cute enough that you'd want to wear anytime, not just during your treatment. But I think that covers all of the side effects that you experience kind of during the radiation. Oh, actually, there's one more that I want to mention that not everyone develops, but it can happen is folliculitis. And those are basically just bumps that you'll notice over the breast. They tend to be kind of in this triangle in the middle portion of the breast. They can be really itchy, bumpy, and there's nothing to worry about. It's actually totally normal. It's just the follicles and the skin getting irritated from the radiation. A lot of women want to put additional cream on this area because they think they're getting the bumps because they're not using enough cream. And the truth is that actually that can further clog the pores and make it more irritated. So sometimes I tell my patients just to kind of hold off on cream in that area for a few days to let it dry out. You can also use hydrocortisone cream, but your doctor can certainly recommend what they want you to do when folliculitis develops. I just want you to know that it's normal and it's something that a lot of women have. It goes away. It usually lasts a couple weeks or so, and it'll resolve at the end of treatment. So I think that's it. Please send us any comments or questions. I'm Katie Deming, and you can find us at makemerrybody.com.